This will be the new home of the School of Public Health at Makerere University, the first institute of its kind in sub-Saharan Africa. For more than 70 years, the school has stood at the front lines of Africa's health, training generations of leaders who have fought HIV, Ebola, Marburg, and COVID-19. Their work has saved millions and shaped the future of public health across the continent. But today, our impact has outgrown our walls. We rent scattered spaces, stretching every resource to teach, to research, and to respond to the next crisis. That's why we are building a new purpose-designed home, a place for innovation, collaboration, and training of the next generation of public health leaders, because Africa's future depends on it. Right now, the continent has only 80 public health researchers per 1 million people, compared to a global average of 1,081. This shortfall threatens our collective health security. Every lecture room we build, every lab we equip, and every mind we train helps close this gap. The $10 million project is already halfway there, powered by, of course, the generosity of our staff, students, our partners like the Rockefeller Foundation, the US state government, NUFIC, plus, of course, many others. We invite you to join us in investing in the future where knowledge saves lives and where Africa stands strong on its own expertise. Because the future of Africa is its people, and their future depends on public health. Makerere University School of Public Health, building the future of health in Africa.
We are grateful for this conference, the 19th Jash conference and the first national conference on communicable and non-communicable diseases. It's a very good opportunity for us to publish and share our findings from the field in Mbale. We have some of the evidence which shows an improvement in the PLE results. So we are very excited about mental health. Mental health is very critical. You can see the impact on health, impact on people's lives, impact on the teachers' lives, and everybody around us. And really one of the main things that came out today was that we need to have all sectors involved in this particular issue. It is a multidisciplinary issue and we need everybody to be on board. So thank you so much for this opportunity.
Non-communicable diseases now account for more than 1/3 of deaths in Uganda. Hypertension alone affects nearly 1 in 4 adults, and diabetes is rising quickly, especially in our urban areas where unhealthy diets, sedentary lifestyles, and obesity are becoming more common. When interventions are data-driven, community-sensitive, and embedded within our health systems, we make real progress. However, success requires partnership among researchers, policymakers, clinicians, and communities. That is why the upcoming conference matters. From November 3rd to 7th, 2025 at Speak Resort Munyonyo, the Ministry of Health and Makerere University will bring together over 500 participants, scientists, policymakers, health professionals, and innovators to share evidence, exchange ideas, and shape Uganda's response to both communicable and non-communicable diseases. I invite you to come attend this important conference. Thank you.
traditionally, we as researchers in Uganda have focused largely on communicable diseases, HIV, malaria, TB, immunizable diseases. Those diseases kill a very big number of people. But we are now recognizing that there's an increasing prevalence of non-communicable diseases. We think that we should pay as much attention to both communicable and non-communicable diseases. And of course, we cannot achieve the SDGs unless, we really pay attention to both communicable and non-communicable diseases.
in countries to which we compete with all sorts of young food. The risk factors that are represented. These risk factors are up to quantity. Then promoting active.
Father in heaven, we give you glory and honor. We bless your name. We acknowledge that this is the day you have made for the annual conference for the communicable and non-communicable diseases.
We are going direct into business in this pre-conference, and we have a number of organizations that will be leading us in the pre-conference.
You've already been welcomed to today's conference, and we are privileged as the Uganda Pediatrics Association to set the stage and kick off the conference.
We encourage our patients who have asthma to have daily inhaled corticosteroids as the mainstay of treatment, other than using salbutamol whenever they need, because continuous use of salbutamol is associated with hyper-responsiveness, or your chest responds worse, what people call addictive to the drug.
In order for us to address, everyone needs to know what sickle cell disease is, how it is transmitted, who is at risk of getting it, not when they have grown and they're going for premarital counseling. It's too late.
Many children are actually not looked after by their own parents. They're looked after by guardians. And I know there's still a little bit of stigma in almost all diseases. How are we handling that?
Richard, we appreciate that actually the half-life of dihydroxymethyl phosphate, DP you mentioned, is about 42 days. But I note you are giving it weekly in sickle cell disease. What would be the sequela of prolonged use of DP, given that actually it's given weekly compared to its half-life of 42 days?
Do you think children with asthma, it's okay to engage in all these kind of activities?
Ministry of Health, we really need to up our game and ensure that we have these screening kits for sickle cell at the NMS and they reach to all government facilities. Thank you.
Out of this conference, what are we saying we can do next year, beginning January, to make sure that our communities are saved from some of these probably easy to solve problems? Thank you.
I used to think that asthma and sickle cell diseases are not treatable. I'm just getting to learn from the presentations here that we can treat these diseases.
Epidemiology of childhood conditions has evolved over time, just as we had one of our oncologists talking about how the cancer epidemiology has evolved. So people who trained a long time ago may not be very aware of the distribution of childhood illnesses of date, but also more information is out there. Research is being done and there's more new knowledge. So the in-service training alone is not enough. The pre-service training. We need to do more in-service training as well to continue to improve the knowledge, continuous professional development of our doctors, both in the tertiary setting, but also in the primary care level, to give them this new knowledge so that as children come, they are better equipped to diagnose them, to suspect, diagnose them, refer them or manage them with the new knowledge and the new capacity, the new skills, the new instruments that are out there now.
we have very many people with sickle cell disease in the country, about 20 to 30,000 babies born every year with the disease. And Uganda has number 5 with the biggest number of sickle cell disease worldwide. So we need to work together, Ministry of Health and other partners, to address sickle cell disease and other non-communicable diseases. And I suggest that capacity building is built not only for health professionals, but for everyone, so that we can sensitize the community and also provide good services for the patients.
Jash conference is actually an excellent platform because it brings together different stakeholders, not just from the clinical field, but also from civil society and other supportive fields in medicine. And why is this very important for pediatrics is because taking care of a child, like traditionally say, it takes a village to raise a child, but it takes the same village to actually take care of childhood medical conditions. And I'm excited that the Uganda Pediatrics Association was invited to this conference, and we kickstarted it because children clearly are our future. And we got a chance to shed light on the burden of NCDs in children and some of the commonly mismanaged or not very well-managed conditions in children. So this has been a great platform for us, and we hope that every year we'll continue to share and raise more awareness. Traditionally, childhood illnesses have been reduced to just acute illnesses, cough, flu, pneumonia, malaria, but that is even just a tip of the iceberg. Childhood illnesses are broader than that. And today, really sharing on NCDs in children, whatever we touched on was just a little bit, but children suffer from any other chronic conditions that adults may suffer from. Things like diabetes, developmental abnormalities.
Welcome back from the break tea. The organizing team, please get us people in the room. The people at the back, kindly let's take our seats as we prepare for the official opening ceremony. We are going to be joined by our chief guest. So we request that we take our seats and then we prepare to receive the official opening ceremony. So I request the members of the organizing committee, people at the back, please inform the coordinator of the poster session that we are pausing the poster session for now as we prepare for the official opening. Let's take our seats and we come to share. In the meantime, we shall keep reminding you, please take care of your valuables, your bags. We are quite a big number, so as you move, keep an eye on your property. And in case of anything, you can contact the ushering team or the organizing team. So the people presenting in the next session, get ready. Once our chief guest comes, we shall be starting the session.
countries, which is eating all sorts of junk food. The risk factors that are represented. These risk factors are out of quantity. Then promoting African.
We kindly request the Ministry of Health leadership, the commissioners and the directors here, and our professors, the heads of academic institutions. We are being requested to move at the entrance, and we usher in the minister. So the commissioners here, the vice chancellors, please, and the professors, you are requested to meet the minister, and then we shall usher you in. We're kindly requesting that you move out and you have a brief as we wait for the delegation to come inside. Thank you. Together with the representatives of the development partners present here with us from the World Health Organization and the US government, please, you can also join in as we usher in the delegation. The rest of us, we kindly request that we take our seats. The teams at the back, please, ushers, ensure that everyone is seated. We still have enough space in front here. Let's not have people standing in the entrance. Once they come in, we shall stand up to welcome them, and then that will be followed by the anthems, and after that, we shall take our seats to have the session begin.
In the countries, which is eating all sorts of junk food. The risk factors that are represented. These risk factors are out of quantity. Then promoting African.
Let's stand up and welcome our chief guests, ladies and gentlemen. it is okay, you can also give a warm hand clap to usher E in. You're most welcome, Honorable Minister, together with the delegation. And I request that before we take our seats, it's in order that we first have the anthems, and then we can take our seats after. We shall start with the national anthem, and then followed by the East African anthem. One stanza. Thank you. You can take your seats. Dr. Stavia, you can come and guide us on how we are going to move.
As the commissioner comes, can I request that we again stand up for a prayer? Let's humble ourselves and pray. God Almighty Father, we want to thank you this morning for bringing us here. We want to thank you for the gift of life that you've given us. We want to thank you for the gift of life you've given our leaders, His Excellency the President, Mama Janet, our ministers, our top leadership at the ministry, and everyone in this room. God Almighty Father, as we begin this day, as we begin this conference, we kindly ask you to come amidst us and be with us and deliberate with us. Give us direction. Be with us. Protect us against the evil spirits that will want to come into this room and destabilize us. We want to pray, God Almighty Father, that as we deliberate, everything we deliberate is for your people, your creation, and for the good of the health of everyone. We make this prayer through your Son, our Lord Jesus Christ. Amen. Thank you.
Thank you so much for welcoming us in the eyes of God. We welcome our permanent secretary. She's right entering the room. You're most welcome, Madam Dr. Diana Twini, to this conference. Our minister is already here. You're most welcome, Honorable Dr. Jane Ruth Acheng. Yes, and ministers, we have quite a number of dignitaries that have joined this first conference on communicable and non-communicable diseases. I request the WR to come and give company to Honorable Minister. I see there are 2 seats and she's alone. She needs someone to talk to. Yes, and I see Professor Roda is coming to give company to the PS. Thank you for that arrangement. So we are going to officially start our opening ceremony. We are some few minutes late, but we hope we'll catch up with time. Allow me to invite the session chair. Our session chair this morning is going to be our Undersecretary for the Ministry of Health, Mr. Akiri Kenneth. He'll be guiding us through the program of the opening ceremony. Please welcome Akiri with a mighty hand clap as he comes to take us through the session. Thank you.
The Honorable Minister, the Permanent Secretary, all protocol observed. Good morning, ladies and gentlemen. Yes, we are going into the official opening ceremony. It has a program which I want to highlight to you. I don't know if it can be flashed. We have conference overview, and we shall have the co-chair, David Musoke, the Associate Professor of Makerere, giving us that overview. Then we shall have a keynote address by Dr. Queen Dube, which will be, presented online. After that, we shall have remarks by the CSO country coordinator. And then we shall have remarks by the Dean Makerere University, Professor Roda Wanyenze. Then we shall have remarks by the Principal Makerere University College of Health Sciences, Professor Bruce Kirenga. Then remarks by the Deputy Vice Chancellor, who will be represented by Professor Robert Wamara, Director of Research, Innovation and Partnerships. Then we go into remarks by the WR rep, and then remarks by the Permanent Secretary, and then we have remarks from our chief guest. So the reason I took us through is for those who will be coming through to prepare. So at this point in time, ladies and gentlemen, I want to take this opportunity to invite Dr. David Musoke, the Associate Professor, Makerere University School of Public Health, to come and give us a conference overview. Thank you.
The Honorable Minister of Health, Permanent Secretary, MOH, all officials from MOH, the leadership of universities here are vice chancellors, deans, principals, and heads of departments, as well as heads of other institutions joining us this morning. Ladies and gentlemen, I wish to welcome you to this first annual national communicable and non-communicable diseases, as well as the 19th Joint Annual Scientific Health Conference 2025, under the theme Unified Action Against Communicable and Non-Communicable Diseases. This historic conference has been organized by the Ministry of Health together with Makerere University, and it comes at a time when we are facing a double burden of disease, as we had this morning, with our long-standing communicable diseases, yet also seeing an increase in non-communicable diseases. This conference has been designed as a national platform to allow us to dialogue, share evidence, but also ensure policy action in line with disease prevention and control, especially in line with ensuring that we have a unified action and of course have integrated approaches to tackle these diseases. This conference has been designed as a 5-day event, and many of you are here over the past 2 days, Monday and Tuesday, when we had the pre-conference activities, which were very successful. And we are now starting the 3-day main conference for the next 3 days. And I want to inform you that the conference, as you may have seen in the program, is made up of 3 plenary sessions, 3 keynote speeches. We have 8 panel discussions, as well as 8 organized sessions, which were part of the 2-day pre-conference. We also have over 120 oral presentations that will be presented over the next 3 days, as well as over 180 poster presentations, not forgetting an exhibition that you're all invited to visit, and this will happen during the break. So I encourage you all to check out the posters as well as the exhibitions over the next few days as part of the tea breaks. We also have on the 3rd day, the long-awaited Dr. Matthew Requiem Memorial Lecture, which is promising to be an interesting session, so please look out for that. And we shall have a final conference statement at the very end to deliberate and to share the key lessons from this event. The expectations from this conference is that we shall have at the end of the 3 days consolidated best practices and models on integrated disease control, but also recommendations to inform our policies as a country, not forgetting enabling us to collaborate more and better across sectors, but also across departments and units and of course entities as we are here. On behalf of the co-chairs of this conference, myself, Dr. Andrew Kambugu from the Infectious Disease Institute, as well as Professor Pauline Biachika from Bara University of Science and Technology, I wish to welcome you all to this conference, but also to thank the organizing committee that has worked tirelessly over the past few months, but also to thank all the partners and donors that have been part of this event, not forgetting the support we've received from the leadership of the Ministry of Health, as well as leadership of Makerere University, who are all here with us. Thank you very much, and I wish you good deliberations over the next few days.
Thank you so much for giving us that overview. So that lays out what we shall be doing for the next 3 days. We shall be here. Thank you so much, Prof. At this point, I've not invited the people who are supposed to share remarks with us here, because we have an online remarks that are going to come through from Dr. Queen Dube, who is giving us a keynote address. So I wanted you to be able to focus on that if he has any projections to make. After that presentation, I'll be inviting you to come and take the podium and assume your seats. So at this point in time, I will request that the team helps us to connect with Dr. Queen Dube, who is supposed to give us a keynote address. Dr. Queen Dube is a consultant pediatrician, is a clinical epidemiologist, and a newborn health program lead at the WHO. So he's the one who is supposed to deliver that keynote address. So may I request that the team, the IT team, connects with her, if it is possible. I will need to be given an indication if that is possible. If you still need some time, probably we could adjust the program. Yeah.
I'm connected.
Okay. Dr. Queen, are you able to hear us?
Yes, I can hear you. Can you hear me?
Wow. You are most welcome. We welcome you to this important conference, and we are privileged to have you as our keynote speaker. And at this point in time, I want to give you the opportunity to deliver your presentation or your remarks. Thank you.
Thank you very much, moderator. Honorable Minister of Health, PS for Health, all protocols observed. Many, many thanks for the invitation to be part and parcel of such an amazing conference. I would have loved to be there in person, but due to circumstances beyond my reach, it hasn't been possible for me to be there in person. So thanks for allowing me to participate in the conference virtually. And such a powerful theme for the conference, especially now that we're grappling with an increase in the number of both communicable and non-communicable diseases. And I'm going to share a few thoughts on the conference theme, but mostly really dwelling on a sub-theme that I have titled Building Healthier Communities Through Integrated Action. So this is the outline for my few reflections. I'll go through the global context, have a few thoughts on why we need unified action, give an example of how it would look like from a pediatric side of things, so looking at comprehensive child and adolescent health agenda, and then finally end with how we operationalize this at a country level. So let me start with a global context. So a few days ago, I believe it's on the 18th of October, we had the publication on the recent global burden of disease. I know we have a lot of people in academia in the conference, and I am sure a lot of us have gone through those Lancet articles. So what I'm going to talk about, especially on the global overview, is partly what was published just a couple of days ago, but also a few reflections from earlier publications this year. So really excited to see that when you look at life expectancy, you remember during the COVID-19 pandemic, we saw a decline across the globe in as far as life expectancy was concerned. But from 2021, we've seen a lot of the countries, a lot of the regions going back to the pre-COVID times. But what is still worrying is the fact that when you look at sub-Saharan Africa, we're way below, what you're seeing in the other regions. We're seeing a slight increase even when you compare to the baseline before the COVID pandemic hit. But we're way below what the other regions are actually expecting. Now, in terms of the global burden of disease, I am sure this is a chorus that we've been singing from the first day of the conference, that we still notice that communicable diseases still pose a threat. We still have unfinished agenda on pneumonia. We still have a lot of children dying from diarrheal diseases, from malaria. TB is still an issue, and HIV is still an issue, especially within the sub-Saharan region. Now, even though we've seen quite a lot of progress in as far as the communicable diseases are concerned in terms of the burden, what we're starting to see is a rising burden in non-communicable diseases. So whether you're looking at it from an oncological point of view, whether you're looking at hypertension, whether you're looking at diabetes, whether you're looking at it from congenital anomalies, things like sickle cell disease, congenital heart disease, when you look at the burden, you actually notice that there is a rising burden in these. Now, many countries, also important for us to reflect on the fact that many countries, particularly with fewer resources, these are the countries that are grappling with a lot of these things. And so we need better access to prevention and treatment for both communicable and non-communicable diseases. Now, when you look at what is it that is contributing much in terms of deaths worldwide, so this is looking at data from 2021 to 2023. Now, if you just look at 2021 and then you compare with 2023 in terms of ranking, 2021 at the peak of COVID, of course, COVID was number one. We lost about 18 million people from COVID. Now, 2023 with COVID under control, we're back to what we're grappling with before COVID. So ischemic heart disease, stroke, chronic obstructive pulmonary disease, lower respiratory infections, neonatal disorders are high in the ranking for 2023. Now, you might be looking at it in terms of death. We also need to realize that in terms of DALYs, you will notice that issues like neonatal disorders actually rank higher than the other things that are ranking much higher for as leading causes of death. Now, when you look at it from a socio-demographic index, and you just are zeroing in on non-communicable diseases, because we already know that in as far as communicable diseases are concerned, the highest burden again is in the low middle income settings. But with a rise in non-communicable diseases, it's also important for us to actually look at it from the equity lens. So when you look at it from a mortality angle, the poorer you are, the higher the risk of you dying. So a lot of the deaths that we see, even from non-communicable diseases, are occurring amongst the poor in our societies. Now, looking at it again in terms of mean age at death. So yes, a lot of these non-communicable deaths are occurring in settings with low income indexes. But when you look at it in terms of mean age of death, pull out cardiovascular disease. Remember, number one as a cause of death was actually cardiovascular. Now, when you look at it in terms of death, look at where Africa sits. The same condition, our people are dying younger. So we're losing people that are much younger compared to the rest of the continent. Actually, there is nearly a 30-year difference between countries when you look at it from the average age to which people are dying from cardiovascular diseases. So we are losing, our population is young, so we should make sure that we're not losing them to things that are easily preventable. Now, why do we need unified action? Many times, traditionally, before I joined WHO, I used to be Director General for Health Services in Malawi. And in a lot of the sub-Saharan African countries, what you see, the way we do programming, even at a ministry level, we are heavily verticalized. So there isn't a linkage many times between the NCDs and people that are pushing the communicable diseases agenda. And even within the NCDs, you also see there's also siloing. Same thing within the communicable diseases. So you will see people that are pushing the immunization agenda, they have their own program. HIV, its own program. TB, its own program. Malaria, its own program. And so on and so forth. We are at such a time that we cannot afford fragmentation and verticalization. We need to get to a place where we now start to push the integration agenda. Now, why do we need really to unify and to really push the agenda as one agenda? Now, important for us to understand that there is an intersection of communicable diseases and non-communicable diseases. Shared risk factors, for example, whether you look at it from a communicable diseases lens or a non-communicable diseases lens, there are shared risk factors. And I'm going to use a case study for us to really understand some of these things that I'm highlighting in this slide. So poverty, malnutrition, weak health systems. We also know that comorbidities worsen outcomes, whether you're looking at it from diabetes, TB. We saw with COVID that, the same COVID-19 infection, if somebody was diabetic, their mortality was much higher. If they were hypertensive, their mortality was much higher. But we also have competing priorities in a health system that is already fragile and, as I mentioned earlier on, heavily verticalized. Now, I give an example of COVID. I also want to highlight another example of congenital anomalies. Now, when you look at the contribution to under 5 deaths due to congenital anomalies, the reported figure is 400,000. But what we forget that within the 4.8 million children that died under the age of 5 in 2023, we know 2.3 million died in the first 4 weeks of life, which is nearly 47%. But we do know that within those under 5 deaths, when you look at children that are vulnerable, children that are at a much higher risk, we know that children that have a congenital anomaly, if they end up, say, for example, with a pneumonia, so if you have a sickler, a 2-year-old with sickle cell disease, and they have a pneumonia, their mortality risk is much higher than a child that has no congenital anomaly. So we know that when you bundle all the congenital anomalies together, the risk of them dying from a communicable disease is 11 times higher. Now, that will not be included within the 400,000. So also, it's really important for us to understand that these comorbidities have a huge impact on the mortality burden that we are dealing with. So important for us really to avoid duplication of efforts, maximize resources and infrastructure, but also strengthen the primary healthcare system and improve population health outcomes. Now, I'll use a case study of preterm and small birth size. I know we have pediatricians in the room, and we know that 2.3 million babies died. 75% of those deaths are actually preventable. The bulk of the preterm of the neonatal deaths are actually as a result of prematurity. Now, we've gone to town over the past decades, really pushing the neonatal survival agenda, looking at it from the lens of let's make sure that the babies survive. But what we forget is the fact that in as far as neonatal deaths are concerned, whether you're looking at it just from the prematurity aspect, a preterm small baby, we forget that before we keep them alive, there are issues that we need to deal with, contextual factors, adverse exposures that would actually prevent the baby from being born early or the baby being small. But what we do within our siloed approach, some of us are specialists just around the preterm side of things. We forget about the contextual factors. We forget about the adverse exposures. Now, I'll give you a very simple example. Syphilis. If a pregnant woman is not screened for syphilis, and as such, they have not been treated for syphilis, we know there's a high risk of that woman delivering early or for her having a stillborn. Now, we might have very qualified neonatologists with all the equipment, but it is better and cheaper to really focus on the prevention side. But we also know that before you get to the adverse exposures, the contextual exposures are so critical. So community and societal factors. So when you look at it from a health system perspective, education is so critical. Environment is so critical. There's a lot of talk now around lead poisoning, issues around heat and its impact on preterm deliveries, issues around plastics, pollution, where we have tiny droplets of plastics in the air that we breathe. And studies have shown that these tiny particles of plastics have also been found on the placenta. We're yet to understand the impact on neonatal outcomes. So let me just go back to the preterm small baby. Now, what we don't realize is the fact that this baby who is born preterm or they are small for death, even when they survive, there are consequences later on in life. Now, when you look at NCDs in adults, we know that these babies that are born small for death, they have a much higher risk of hypertension, other cardiovascular diseases, metabolic syndromes like type 2 diabetes, renal dysfunction, and other things. We also know that they have a much higher risk of growth faltering, developmental delay, and so on and so forth. So we cannot afford to tackle one thing at a time. If we really want to see progress, we need to have a holistic, comprehensive approach to NCDs and communicable diseases. This brings me to this very important factor that it's really, really critical, especially now that within our ministries of health, we start to push a life course approach. Starting from preconception, conception, when the baby is born, linking them to early child development. School health, very, very, very important. Self-learning environments. Universal access to sexual and reproductive health. No matter how much we invest in the health sector, if we don't deal with female education, say for example, we will not be able to attain the SDG targets. So it might not be primarily a health sector issue, but things that are happening in the other sectors, water and sanitation, have a direct bearing on outcomes for health. So very, very important that we look at it from a comprehensive angle, but also using a life course approach. As well as WHO, we are actually promoting a healthy growth person-centered life course approach. Moving from a disease-centered approach, where you're looking at it from this person has HIV, this person has diabetes, but looking at it from a person-centered approach. So it might be a 12-year-old who is a sickler, but what is the package that they need as a 12-year-old, and aside of me dealing with their sickle cell? So what else do we need to make sure that we provided for that girl in a comprehensive manner? Now, I'll talk a little bit about the comprehensive child and adolescent health agenda, using this as an example on how we can have unified action. So a lot of it comes from the improving the health and well-being of children and adolescents, but also the WHO recommendations on antenatal care for a positive pregnancy experience. So what is the vision for this comprehensive agenda? Now, we're looking at a world where every child and adolescent is optimally healthy, they're being raised in a safe and secure environment, is appropriately prepared physically, mentally, socially, and emotionally to accomplish age-appropriate developmental tasks and contribute socially and economically to their society. And the way we're looking at it, we're focusing on the first 2 decades of life, the first 20 years of life, moving away from just focusing on under 5 survival, but really looking at the first 20 years of life. Because if you really have to see change within our countries, we need to move from the survival agenda to the thrival and the transform agenda. Now, when you move from the survival agenda to the thrival and transform agenda, you will not stop at the age of 5 years. You will need to go through and through to the first 2 decades of life. So actually behind this comprehensive agenda is what we're calling the well care visits and contacts. I'll share the links together with the organizers of the conference at the end of my talk. So the objectives are actually fourfold. So we're looking at disease prevention. Prevention is very, very important, but looking at it from a comprehensive angle. So looking at it from the contextual angle, looking at it from the exposure risks, and really seeing how best can we move together forward. Health promotion, very, very important. So school health is really, really critical within the health promotion. Problem identification and then anticipatory guidance. Now, in terms of how we operationalize this, I wish I had a bit more time to really highlight how we've packaged the Well Child agenda. Now, in terms of how you operationalize this, I mentioned initially that we need to move from the survival agenda to survive, thrive, and transform. We're moving away from just looking at the under 5 age period to really spanning across a preconception throughout the first 2 decades of life. Ecological approach to services. Moving away from just a health sector type of programming to multi-sectoral actions. So in as far as health is concerned, whether it's communicable and non-communicable diseases, many times when we're planning, we're budgeting, we're developing our strategies, we do it as the health sector. We don't have the other sectors in the same room planning on a combined agenda. So what we're really pushing for is a change in the narrative. Start within the health sector, where you have the immunization folks sitting together with HIV, sitting together with NCD, sitting together with everybody else and saying, what does a 5-year-old need? What package do they need at a community level? What package do they need at health center level 1? Health center level 2, health center level 3. What package do they need at a community hospital level? What package do they need at the level 2 facility level and level 3 and level 4, depending on how many levels you have in your system? Not this parallel way of programming. And then even within the sector, being able to say, for this particular aspect, we need the Ministry of Education to sit with us. Because in as far as the first 2 decades of life are concerned, we cannot do it alone as a health sector. We need education to be part and parcel of the programming and the planning. Shared vision, shared milestones, shared targets. And if we do these things, sorry, my screen has frozen. Let me just stop sharing and share again. I'm going towards the very end. These are the things with technology. I think it's one more. So really a shift to a life course approach to programming, extending it beyond the first 5 years of life, as I mentioned, refocus, really emphasis on quality, coverage, and equity. We know that at least 2 million mothers, newborns die every year as a result of poor quality. They access the services, but they still die because of poor quality. We need to build our children and adolescents, build resilience by promoting their health and well-being. Now, I talked a little bit about this ecosystem that is very, 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 very important, moving away from just a health sector to a multi-sectoral approach. And essentially what we're really trying, apologies, I'm afraid that if I put it in slideshow again, it might freeze. Now, issues around good health, adequate nutrition, responsive caregiving, opportunities for learning and education, and so on and so forth. We need to use a multi-sectoral approach as we're pushing this forward. Primary health care being the foundation. We all know that primary health care, this is the first point of contact for prevention and treatment. In terms of platforms for integrated services, primary health care is better placed. Unfortunately, it starts from this national central level where people are running their own programs. And when you go down, it is the same nurse that has to run with HIV, run with TB, but different registers, different supply chain mechanisms, different data platforms. We cannot afford that now. with this comprehensive agenda, we need to have one approach to all of these things. And so the academia has a role to play. It's easier said when we're talking about a comprehensive agenda or an integrated package, but it does need some innovative solutions. So for example, the data platforms. If I have to create one data platform for children within the first 20 years of life, what does that exactly mean? What are those critical variables that I need to keep? What are those critical variables that I need to deal away with? So a lot of thinking that needs to go into the integration agenda. But critically also important is policy change. So our policies of verticalization, we really need to move beyond those policies. Now, a few lessons. Barriers to unified action. You know, people love to do things in a siloed manner. Yeah, because again, when we're talking about funding streams, it also comes in a verticalized manner. I'm only funding cervical cancer. My funding is for just malaria. You forget that that malaria child can also have sickle cell disease. My funding is only for pneumonia. My funding is also, we need to get away from that and start to talk about funding for child health, funding for packages for a child who is 8 years old, funding for packages for children that have chronic heart disease, funding for packages. And so we move away from these fragmented funding streams that are so expensive at the end of the day. But we also have limited workforce. So sometimes when you talk about integration, the way we train our people, sometimes, especially at a community level, maybe they're only allowed to do, they have the capacity to do a few things. When you add other things to the package, that becomes an issue. So a lot of thinking also needs to go into the health workforce, how we're training them in the pre-service programs, postgraduate programs. Are we training them in a comprehensive manner? Or our training also is very much verticalized. So let me conclude by saying, whether we like it or not, health is interconnected. Our response must be too. Whether you are just within emergencies, you can have a 2-year-old that comes in conversing, but the underlying problem is a cerebral malaria. Health is interconnected. It is high time, this is actually common sense. Our response needs to be interconnected. We also need to understand that collaboration saves lives. The more fragmented we are, the more costly it is in terms of resources, but also many lives are lost. Together, we can build a healthier, more resilient world. Can we, out of this conference, join forces, the NCD community and the communicable diseases community, to become one community, one agenda, the survival, thrival, and transform gender? Thank you.
Wow. Thank you so much, Dr. Dube. This is a well delivered keynote address, and I would want to request that we give her another second round of applause. Thank you so much. We want to appreciate you as a ministry and as stakeholders in the room for this wealth of information that you've shared with us. I will just highlight few of what I have picked as a person. Critically, we need to adopt a multi-sectoral approach in dealing with some of these challenges, communicable and non-communicable diseases. It is important for us to adopt that approach because of the social determinants of health, which we cannot deal with at Ministry of Health level. Number two, we need to work with all the other stakeholders and have shared vision, shared action, and shared targets. At MOH, we say one budget, one plan, one M&E. I think this is the direction in which that is pointing. It's critical for us to pay attention to PHC as the foundation for prevention and treatment. Also note from her presentation, and which was also spoken to earlier by Dr. Oyo, that the rising burden of NCDs, globally is alarming. So there is need for us to build better systems for access, to prevention and treatment of both NCDs and communicable diseases. We need a unified action. Actually, when she was delivering on integration and a unified action against some of these challenges, I reflected on what we are trying to do back, at the ministry. I think this is the way forward, and the PS and our leadership are really moving us in that direction. So unified action is the way to go. Whatever challenges probably could be, we just need to see how we handle them and move in that direction. Focus should also be on building structures at community and society level to be able to deal with these challenges from where they emerge from. And then second last, we need to learn to prioritize, give a lot of, we cannot handle everything at a go. Let's pick critical aspects and attend to them. And then lastly, we need a policy shift, and she was able to highlight that to us. The concluding remarks she gave us are very, very instructive, indicating, how we need to ensure that we collaborate, like I had said, and then also reminding us that health is interconnected, the more need for a multi-sectoral approach. And then she told us that once we work together, we shall be able to achieve the dream that we desire. So I want to appreciate her once again. Thank you, Dr. Dube. We appreciate these, remarks and this presentation you've given us. So at this point in time, I'm going to invite the other members who are supposed to give remarks to come in front. May I now, at this opportunity, request Dr. Lydia Mongerera, who is the CSO representative, to come and take a seat at the podium. I will also request Dr. Professor Rhoda Wanyenze to come and take the front seat. I'm told the CSO representative is Mr. Murumba Matthias. Please come through. Apologies. Yes, you're welcome. Apologies for that. Professor Rhoda Wanyenze, Professor Bruce Chirenga, you're welcome. Professor Robert Wamara, come and take the front seat. The representative for WR, you're welcome. I will save the last two. The PS and the Honorable Minister will remain where they are, and then they will, from there, they will deliver their remarks. So at this point in time, may I now request Mr. Murumba Matthias to come through and deliver your remarks. Thank you.
Thank you so much, the MC. Good morning, ladies and gentlemen. So good afternoon, ladies and gentlemen. My name is Mulumba Matthias Suna. I represent civil society organizations and communities at the Health Policy Advisory Committee, HIPAC of Minister of Health. Allow me at this point recognize that we have other civil society leaders in this room and seniors like Dr. Lydia, Flavia, the HIPAC representative, CCM, kindly stand up for recognition, and if you can, some of the leaders, you can join me at this podium. If you're a civil society leader, please stand up so that you wave to the minister and we commit ourselves to support this process. Kindly, civil society organizations, NGOs, CSOs, CBOs, can you stand and wave to the minister? Thank you so much. Some of them are here standing with me to make sure that we commit to support this process. As mentioned, as civil society, we are organized in different leadership positions. We have HIPAC, CCM, but also we are supported through PRR2. I know Jack is here, the TASO Grant Management Unit, and we are supporting several processes within the national response. As civil society organizations, we get the mandate from the communities and we support the communities, and on behalf of these communities, we stand here to reaffirm our commitment to strengthening Uganda's health system by leveraging existing capacities built around communicable and non-communicable diseases to deepen community engagement and improve health outcomes. We thank Minister of Health, Makerere University, and other organizers of this very important engagement. We don't take it for granted to have been invited to speak and also participate in the organizing this event. Thank you so much. Let's clap Dr. Stavia and the rest of the team organizing committee. Thank you so much for engaging us into this process. Over the past decade, Uganda has made significant strides in building infrastructure, human resources, and technical capacity to address communicable and non-communicable diseases such as HIV/AIDS, tuberculosis, and others. But simultaneously, growing attention has been directed towards the rising burden of NCDs, including hypertension, diabetes, cancer, and mental health conditions. These dual investments present a unique opportunity to create integrated, community-centered responses. We subscribe to the intention of this conference and once again reaffirm our commitment to the shared vision that has brought us all here to make sure that we fight these deadly diseases. As civil society, we believe that communities are empowered with the knowledge and tools to prevent and manage both communicable and non-communicable diseases. We believe that health systems are responsive and we want to continue being inclusive but also resilient. We know that community health workers, including us as civil society organizations and local leaders, are central to the health promotion and disease surveillance. We believe in strategic priorities and therefore commit to integrating and well-coordinated programming and service delivery. We believe we need to do capacity building at all levels. We believe in having community empowerment, like we said, as representatives of communities and civil society, but also as civil society, we are continuously engaging in data and digital engagements. So don't leave us behind in research, and we believe in research and we are also part of that. But also as civil society, one of our mandates is advocacy, but also equity and inclusion. And we believe this is one of our key areas of interest. We are reflecting about the different levels of civil society, including community level, but also the upper civil society organizations. Because of time, I know we have taken a lot of time. I don't want to read verbative, but probably pick out a few points for us to catch up with the time. And I know our Honorable Minister knows most of what we can do at community level. At community level, we have done and we shall continue doing community education and awareness. And it's one of the issues that has been raised as one of the preventive ways of how we can fight these diseases. We are part of the service delivery system and want to continue to commit to do that, but also we are experts at behavior change and mindset change. So we commit as to all the other partners here present, please give us the mandate and support to do that. But also now at organized level, as civil society organizations in different levels, like we mentioned, the CBOs, the faith-based organizations, the NGOs, like we always do, we do advocacy and accountability. And our belief is that we should have mutual accountability between us as civil society organizations and all the other stakeholders. We need to hold each other accountable. And the rest of the issues have been mentioned at the other levels. We understand we have development partners present in this room. As civil society, we all know how much we have been affected by the shifts in the global trends of funding, but we believe we can still do a lot, especially through the integration approach and multi-sector approach. And therefore, the funding and technical support that you have as development partners is very, very important and central for us. But also the universities here, Makerere University, Mbarara University, we need to have a cordial relationship and probably work together so that the researches you do at PhD don't remain at shelves, but we deliver them to the communities. We are also very, very much emphatic on strategic coordination, and we think that we can be very, very we can deliver if we are very much well coordinated. Many gaps have been identified through the processes, the pre-conference, but also the previous speaker talked about several gaps. Allow me to save again time, not to go deeply into each of the gaps that have been mentioned because of time. I just want to go direct to the call of action that we together have designed and request out of this conference. The call to action is saying that we need to be very meaningful government stakeholders to prioritize and integrate health approaches in national planning and budgeting. Call us again, invite us always, not at the end, but always from the start up to the end, like we have always done. Our development partners, again, we are saying, we request you for the support that you have always given us, because we know we have the best practices and some of the issues that communities really can use to ensure that we do the prevention of some of these diseases. Of course, the financial support and other logistical support is very much needed, but also for the local leaders and CSOs, we want to reaffirm that we can be champions in health literacy, because we all understand that awareness is one of the main ways of how we can do mindset change. But also, like I mentioned, the accountability and mutual accountability between us, but also government and others. Finally, Honorable Minister and the peers, as civil society, as you've seen, we are coordinating in various ways through the HIPAC, through the CCM. We believe in coordination, and we really want to work together with the ministry to ensure that the coordination structures of civil society of recent, they have not been well supported, and if we are not well coordinated, we believe we shall not be able to coordinate the rest of the civil society in the country to do most of these health processes and outcomes that we really need to achieve. I once again thank Minister of Health, Makerere University, and other stakeholders, including the donors that have made the pre-conference, but also this conference that we are starting now, possible. I must mention that together we can transform Uganda's health landscape by building on what we have, bridging the gaps that we are already identifying, and this conference should be deliberate on centering communities and civil society in the fight against these diseases. I remain Prince Suna Mulumba Matthias on behalf of the civil society. Thank you so much.
That was very good.
Let's give them another round of applause. Thank you so much, civil society. We appreciate you, and we know the very important role that you play in supporting the healthcare. We want to appreciate you. They have also hinted on integration, integrated community-centered approach. Everybody is now talking about integration because that's the way to go. Elements of capacity building, equity and inclusion, coordination, and importantly, they also help us on aspects of accountability. We want to appreciate you. Thank you so much. At this point, ladies and gentlemen, allow me to invite Professor Rhoda Wanyenze, the Dean Makerere University School of Public Health, to deliver her remarks. You're welcome, ma'am.
Thank you. And Honorable Minister, the Permanent Secretary,
and the leadership of the rest of the leadership team at the Ministry of Health, our vice chancellors and leadership of the universities that are represented here, and all of you are partners in your respective capacities. I really, really feel delighted to be part of this meeting today, and so delighted because it's truly a unified action. It's not just a Ministry of Health conference, it's not just the university conferences that we often have. It is a collection of everybody that we need to make a difference in this space. As we've heard from civil society, there are multiple implementers here. We have our UN partners in the room. We have the media as well. We need you, media. You've heard about getting the information to the communities, but we also have representatives of the community. So we have everybody that we need to make a difference. And it's really important that when this conference ends, that it's not just speeches, but that we truly have an outcome that we can use as a basis to reinforce the plans that the Ministry of Health has already started with the integration agenda. So I'm truly delighted, and on behalf of the School of Public Health that's leading the organization from the university side, I would like to really, really appreciate you all for taking your time to be a part of this meeting. And I think we need to clap for all of us for being a part of this. I will not go through a number of things that I thought I would say after that excellent presentation from Dr. Queen Dube that covers a lot of the issues that I thought I would speak to. But I would just mention one issue that I would like to emphasize, being from the university and from the School of Public Health, that we need to think carefully about data and the role of data, so that we better understand what's happening around us. We've just been from the World Health Summit, and we had a session on precision prevention, and it all rotates around understanding the individual, the communities, a term that has been borrowed from the precision treatment coming from cancer treatment, but we've now extended that to also apply to health promotion and prevention. And we can't achieve precision prevention without data. Coming from HIV and other infectious diseases, we've been talking about know your epidemic. We need to know our NCD epidemic. We need to understand the exposures and all the underlying drivers. So we need data, we need to improve surveillance, and this is an area that's close to the space that we've been working on for a long time in partnership with Ministry of Health, that for decades we have been like the arm of the Ministry of Health in terms of generating that critical evidence, and we commit to continue to do that. And we do appreciate that we've worked in partnership with you to do previous NCD surveys. Professor Gua today was sharing here this morning data from a survey that we did in collaboration with the Ministry of Health and the World Health Organization. So thank you. We hope that we can sustain that partnership and continue to provide the critical evidence to drive the decisions that we make. This year, we've just also concluded data collection for the HIV impact assessment, the Uganda HIV impact assessment, the population-based UFIA, which for the first time also integrated non-communicable diseases. This is the very first time, and it aligns very well with the integration agenda of the Ministry of Health. So for the first time, we will understand the picture of non-communicable diseases across HIV-infected people and those that are not HIV-infected, an opportunity that we had lost previously. We will continue to do this and explore all opportunities to generate evidence to drive the planned integration and unified action. And we hope to work with you to look more at the resilience of our systems, not just for the health sector, but also looking at the broader systems for health that extend to other sectors. I would like to commit as School of Public Health, and I hope it also applies to the rest of the university representatives here, our vice chancellors, that we shall look at our training. Our workforce is absolutely critical. We need to send out a workforce that's aligned with this agenda so that the ministry can spend less money and time training people in service that are not well prepared. We need to look at our teaching. We also need to look at our research agendas, both for our students. Queen Dube challenged us about this as well. What research are our students doing? Where are the innovations? And recently someone said universities are very good at describing problems. No, we are going to become very good at finding solutions as well. So we commit that we are going to look at our agendas, our research and innovation, and begin to do more to support this agenda. And we have engaged on this, and it's reflected in our strategic plan as the School of Public Health, and we'll continue to examine this, especially looking at the outcome of this conference to see if there is anything that we've left out that we would like to do more of. One of the areas we would like to speak to more is the exposures in the environment. Queen Dube talked about the lead. There's so much happening here. We are spraying everything. We spray, whether it's the herbicides, whether it's the pesticides, we are spraying so many things. Apparently, we even spray food after we've harvested it so that it's preserved, and we don't even know what we are using. So there's so much happening in our environment, and we are hoping that our colleagues in the Department of Disease Control and Environmental Health can do more in this space. We have started doing some work with air pollution, and we are doing that tracking, and we have quite a bit of data. I hope it's going to be presented here today. But there are other exposures and waste and other issues, including electronic waste that is hazardous, that we don't fully understand. We are hoping that we can drive this agenda again together with the Ministry of Health so that we can address the gaps that exist. Finally, I just wanted to say the School of Public Health has grown, and in our agenda to try and address all these areas, we have opened up a series of courses, including health informatics. We now have a master's in health informatics, and we've worked with you, Ministry of Health, to also grow the data science, and it will be launched soon. So we have lots that we are doing, and because of that, the university has given us space to grow further and open up more programs. So since January this year, the School of Public Health is a standalone school within the structure of the university. But I wanted to emphasize that standalone, unified with the College of Health Sciences, and we are jointly celebrating 100 years of the College of Health Sciences and Medical Education at Makerere this year. You're going to hear more from the principal, Professor Bruce Chirenga. So what we are doing is growing, but remaining unified in the research that we do and in the health training. So in case you hear about that, don't worry. We are unified and we are together. And with that, I would like to thank you once again and appreciate the leadership of the Ministry of Health for finding it necessary to work with the university on a joint conference moving forward. It's really an excellent arrangement, and we need to appreciate, let's clap for the Ministry of Health. The integration truly, when we read that circular from the PS, is working. So the ministry is integrated with the university, and as we speak resilience of systems, there is no resilience without resilient universities that can play their role in terms of advancing the work that we do. So thank you so much, Ministry of Health. We are looking forward to continuing joint conferences, and also to make sure that electronically virtually, that our students who are the leaders of tomorrow are able to fully participate in these conferences so that they are not in class being taught when we are presenting current data here today. So we are going to do our best to make sure that we expand the reach of that. Thank you so much also to our partners that have made this possible, but especially thank you to the Joint Organizing Committee of the Ministry of Health and the university, from the School of Public Health, all the teams that have been chairing this. Dr. David Musoke has mentioned everyone, so I will not go over that again in the interest of time. Enjoy our time together, and we are looking forward to the outcome from this meeting. Thank you.
Yes, thank you so much, Professor Roda. We appreciate quick highlights, data and the role of data, need for evidence generation. If you must have precise prevention approaches, if you must know your epidemic, if you must improve surveillance, you need evidence. So that's critical. Systems for health, we need to build resilient systems. Training, a very critical aspect, preparing the workforce that is going to take forward the integration agenda. Then the solution-oriented research, dealing with the exposures in the environment. And then lastly, undertaking training and focusing on courses that are critically required in the healthcare. So I want to appreciate you so much. At this point, may I invite Professor Bruce Chirenga, who is the principal, Makerere University College of Health Sciences, to deliver your remarks. Let's operate between 5 to 7 minutes. Thank you.
Honorable Minister, our Minister of Health, we are very delighted to have you here. Thank you so much for honoring the invitation to be at this meeting. Okay. Madam PS, you are welcome. All Vice Chancellors who are here from the different universities which have participated, more especially the representative of our Vice Chancellor. I see he has moved out a bit. Professor Wamala, you are welcome. All directors in the Ministry of Health, commissioners. I don't see many directors, but at least I see one, so I know the other directors are here. All professors, students, ladies and gentlemen, I don't know who have I left, boys and girls. So on behalf of the College of Health Sciences of Makerere University, I want to welcome you here. It is a great pleasure for us to be attending this conference that is jointly organized by the Ministry of Health and Makerere University College of Health Sciences, led by our School of Public Health. But I want us to think about one thing. So many conferences. What is the role of conferences in ensuring achievement of universal healthcare coverage? I will attempt to mention 4 key things that conferences deliver. The first one, conferences, workshops, seminars, summits, they allow us to conduct science communication, because for some reason, we need to break down the science for the people it is intended to help. And therefore, I want to welcome all the journalists who are here, the civil society, and anyone who can break this science for the people it is intended to help. Secondly, conferences help us to share amongst ourselves as scientists what we know. If you remember very well, if you find something and you are the only one who knows that thing, there are 2 possibilities. You are either genius or you are the opposite of the genius. So by us coming together to share what we know, we help each other to grow the knowledge of science as a body. Conferences also help us to network and to do mentorship. And Prof. Rhoda has said the importance of having our students here so they can see us in action. Honorable Minister, this conference is special. It goes beyond these four things. It is bringing the policymaker and the researcher or the academia in the same room, shortening the distance between the policymaker and the researcher, and therefore has the potential to ensure that the results from this conference will be implemented. I want to thank the people who came up with this idea, especially the madam walking around, Madam Stevia, who really pushed this. Initially, as the College of Health Sciences, as you've seen, this is the 19th Jash. We thought that we would continue with our Jash, but the ministry persuaded us. Honorable Minister, Madam PS and others, this conference is special in another way. It is looking at the dual epidemic of communicable and non-communicable diseases. As we know, I don't want to repeat a lot, there has been a problem of infectious diseases, but these NCDs have come for us. These days, it's very difficult to find a person of my age who is not taking something. If you are of my age and above and you are not taking anything, you need to thank God. So by us coming here to address this problem, I don't want to go so much in details. It creates a paradigm shift in what we have been thinking. Honorable Minister, ladies and gentlemen, this Jash of the 19th Jash in the College of Health Sciences comes at a time when we are celebrating 100 years of health professions education for this country, the region, and Africa. And therefore, we congratulate ourselves for being alive today to see this. But of course, we want to stand and thank our predecessors who started this journey 100 years ago. Honorable Minister, we have organized a few things to celebrate this 100 years. And this actually includes all the universities, because most of us started around Makerere University. One, we had a public dialogue where we had experts talk about the issues affecting health professions training in this country. Honorable Minister, in that meeting, many things were discussed, and I'm sure you saw the report. But one important thing, our product is not being consumed, especially the nurses and the other allied healthcare professionals. We need interventions to make sure that these products are consumed. We ask you to use all methods available to you to open up your consumption of these products. You are the biggest consumer. As I talk today, there are 40,000 nurses on the street, or its equivalent. There are male nurses riding borders. We really need to come up with interventions to solve this. Of course, as I will say lastly, this is a problem we have created through the good leadership of our president of promoting science. There are many children graduating with the science, and one of the ways they go is healthcare professional training. The other activity we organized is a run, where the Director General was the chief runner, and this was read by our students. Now, I don't want to talk about history. Let me talk about the Sentinel Dinner. All of you, you are invited on the 12th for a big dinner, the biggest dinner you will ever see. It will be in the Freedom Square. We will have food for everyone, yeah? And we want to celebrate their 100 years. Please come. On that day, we'll launch the fundraising for the key project we are going to implement that we think touches most of you alumni. You remember the famous DLT, the people who went through medical school. You sat there. Right now, I have 535 first-year students. The DLT can take 130. So our intention is to expand it, of course, alongside other infrastructure projects that we have, but also we want to install a monument for you, which you should come and touch and know I was here when we made 100 years. Honorable Minister and MC, I'm about to finish. Another thing which is happening in addition to this meeting, which brings the policy and the researchers, is the Africa Health Summit. I have no permission to announce this, but I'm part of the organizing committee. It is happening on the 14th, which is next week, another big meeting. But this particular meeting wants you researchers to meet a new group which has emerged in the healthcare system, the manufacturers of products and the people who are developing for Africa. Please plan to come. Lastly, I'm going to give thanks, and actually that's what I was supposed to do. I thank the organizing committee, led by the School of Public Health, especially the Dean, who is here. Thank you so much, Professor Roda, and David, the chair of the organizing committee and your committee. I want also to thank the Ministry of Health team, led by Dr. Stevia, and all your people for organizing this conference. I want to thank the wider College of Health Science community, which has supported the School of Public Health, especially the college management team, but also the Makerere University top management. We cannot be here without their clearance. I want to thank all the presenters, whether poster or oral, that you made it here. I want to thank the sponsors, the delegates, and the service providers. Very lastly, I want to thank the government of Uganda. Us being here in hundreds here is a testimony of the gains. Yes. That we have had a system to be able to showcase the gains in science by holding such big meetings. And I want to use this opportunity to thank our government, led by the President, for the leadership we have had for the last 40 years and more for us to be here. Lastly, I want to thank God who has allowed us to be here. Thank you.
Yes, thank you so much, Professor Bruce. I thought certain statements were for us artists, but I have now known that even scientists have been oriented. But thank you so much for your remarks, and we take note of the issues that have been raised, especially on consuming the products that you produce. And I think the policy holder is in the room. She will be able to respond to that. We also take note of the invite for the different events you have highlighted. So thank you so much. At this point, may I take the opportunity to invite Professor Robert Wamara, who is representing the Deputy Vice Chancellor, Academic Affairs, Makerere University, to come and deliver your remarks. Professor Robert Wamara is the Director of Research, Innovation and Partnerships. You're welcome.
Thank you very much. Honorable Minister of Health, the Permanent Secretary, distinguished members of government present, World Health Organization and development partners, our distinguished keynote speaker, esteemed colleagues from academia, the DVCs and the VCs present, our partners, our students, and early career researchers, all invited guests, ladies and gentlemen, allow me to say a good afternoon once again. It is my distinct honor to join you at this historic convening, which is the first annual National Communicable and Non-Communicable Disease Conference, jointly held with the 19th Joint Annual Scientific Health Conference. This collaboration between the Ministry of Health and Makerere University marks a key milestone in our national health agenda. It is one of the first platforms in the region to intentionally merge dialogue on communicable
and non-communicable diseases, recognizing that our health challenges and solutions are interconnected, like has been said before. The theme of this inaugural joint conference, which is Unified Action Against Communicable and Non-Communicable Diseases, speaks to the urgency and opportunity before us. And therefore, Uganda continues to confront long-standing communicable diseases such as malaria, HIV, and tuberculosis, while diabetes, cardiovascular diseases, and mental health challenges also are on a rise. And so this dual burden of disease weighs heavily on communities, especially the most vulnerable, including women, young people, the urban poor, rural households, and populations often excluded from decision-making and access to healthcare. To respond meaningfully, we must build coherent, inclusive, and resilient health systems. Systems that understand disease not only in biomedical terms, but also through the lens of equity, identity, livelihoods, and lived experience. Allow me affirm that Macquarie University is honored to co-organize this conference alongside the Ministry of Health. For over a century, Macquarie University has been central to nurturing health professionals, advancing health science, and informing policy across Uganda and the region. And so the partnership between Macquarie University and the Ministry of Health reflects a shared belief that knowledge, policy, and practice must move together, grounded in evidence and public service to transform health outcomes for our people. Allow me at this juncture pay special tributes to Macquarie University's School of Public Health, now a standalone school with a college status within Macquarie University, for its visionary leadership in organizing this conference with the Ministry of Health. For more than 70 years, the school has been at the forefront of public health training, research, and policy, influencing decisions in Uganda and the region, and strengthening national disease surveillance, shaping primary healthcare models, advancing HIV and epidemic response, pioneering health system research, and building a public health workforce that now serves across Africa and around the world. Under the stewardship of Professor Rhoda Wanyenze, like has been said, the school has not only coordinated this conference, but has also been instrumental in conceptualizing this inaugural Unified National Platform. And so this bold milestone reflects the school's enduring legacy and unwavering commitment to generating evidence, nurturing excellence, and transforming public health practice in Uganda and beyond. It is also fitting to mention, it is also fitting that this moment arrives at Macquarie University's College of Health Sciences celebration of 100 years. Essential of training health professionals, building research capacity, and strengthening health systems. Today we stand on the shoulders of giants, and we carry forward a legacy that is defined by rigor, relevance, and service. Allow me to express our sincere appreciation to the Ministry of Health for this strategic partnership and entrusting Macquarie University with a pivotal role in this shared endeavor. Together, we are demonstrating that national capacity advances most sustainably when training and public institutions stand side by side. To our partners, the global health organizations, to local community-based groups, thank you for your solidarity. Thank you for your contribution. And thank you for standing with Makerere University. Your presence affirms a shared belief in Uganda's ability to drive innovation and resilience in the health system. And therefore, let this conference not be just an event, like has been said, but the beginning of sustained national health dialogue, one that will shape the system, inform policy, and strengthen collaborations for years to come. In closing, as we open this important conference, let us commit to 4 things. Number 1, advancing science with integrity. Number 2, designing systems that protect the most vulnerable. Listening deeply to our communities. Turning knowledge into action. And then lastly, ensuring that no Ugandan is left behind. Together we can build a healthier, more equitable, and more resilient Uganda. Allow me to wish you all a productive deliberation and meaningful engagement throughout the conference for God and my country as we do build for the future.
Thank you. Thank you so much. Let's give him another round of applause. Thank you, Professor Robert, for your remarks. Need to build resilient systems is taken note of. Call for sustained national dialogue is also taken note of. Advancing science, protecting the vulnerable, turning knowledge into action or solutions, and ensuring that no one is left behind. I think that is the theme for universal health coverage. Nobody should be left behind. We appreciate your remarks. I think I've been privileged to moderate a session with the highest concentration of professors. This is not, so I want to appreciate the ministry for the partnership. This is it's a rare opportunity. So thank you so much, Professor Robert. May I at this point in time invite Professor Pauline Byachika. Professor Pauline Byachika is the Vice Chancellor of Mbarara University of Science and Technology. She has been handy in supporting this event. And we are also privileged to have most of your products delivering very critical role in the healthcare. Thank you. You are most welcome, ma'am.
Honorable Minister. Oh, is it on? Honorable Minister of Health, Dr. Jane Ruth Acheng Ochero. Our PS, Dr. Diana Atwine. Professors present, the Vice Chancellor and representative of the Vice Chancellor of Makerere University, directors, commissioners, esteemed colleagues, ladies and gentlemen. It is my pleasure this afternoon to stand here before you to speak. Although I was not on the program, but I'm very delighted that I've been given the opportunity to speak. And I'll speak on behalf of Mbarara University of Science and Technology. I bring you greetings from Southwestern Uganda, and in particular from our university. I'm very glad to see many from Mbarara University of Science and Technology here present. Should I ask them to stand up for recognition? Please stand up for recognition, led by the PS, Dr. Diana Atwine. Yes, there are very many, and you can see they are all esteemed colleagues, including Dr. Stavia, who is the lead organizer for this conference. Thank you very much for keeping the banner very high of Mbarara University of Science and Technology. As we gather here this afternoon to discuss pressing health challenges that affect all of us. This is a great platform, and I want to thank the Ministry of Health for having led us to this unified platform that is bringing us together to discuss these great challenges and to pave way for prevention, for better care, for management, and for better training for those of us who are in the training institutions. This platform has brought us together as policymakers, trainers, healthcare providers, and the community. And therefore, it is very encouraging that we can come together in a unified way to fight these communicable and non-communicable diseases. But as we discuss, I want to say that we shouldn't forget the big burden of road traffic accidents that occurs almost every day in our country. I looked through the program and I didn't see many papers on this, but I think as stakeholders, we must take interest to think about prevention of these road traffic accidents. Because you might eat those fruits, you may not take alcohol, you may do physical activity and not get the NCDs, but you might be involved in a road traffic accident. And for those of us who travel long distances, we know what it means. So I want us to think about that very critically so that we can all work together to prevent that. I will not say much because of time, but as the Vice Chancellor of Mbarara University, I want to thank the organizers of this conference. And I hope that going forward, we as other universities will continue to be involved in these national meetings actively so that we can also contribute to the discussions here in the national meetings. I want to encourage all of us to commit once again to build the resilient health systems as the Dean School of Public Health talked about, because we all have responsibility towards this, both at individual level and at collective level. We had the risk factors. It is a matter of eating fruits, staying physically active, not leading sedentary lifestyle, which is at an individual level. But also at a community level, we can advocate, we can teach our communities to be able to prevent these diseases. So my point is that both individual and collectively, we can together fight the non-communicable diseases. My own specialty is in the infectious diseases, mostly malaria, HIV, TB. But as we all know, diseases don't read books. They do not occur singly. Therefore, it is still my responsibility and our responsibility to talk about the NCDs. Having said that, as a Vice Chancellor, I'll continue to commit, and to you, our Minister of Health, and to the leadership of the ministry, we, as the leaders of academic institutions, will continue to commit to train and build that human resource that is able to participate in the prevention and control of these diseases. And we shall continue to train the human resource that is able to apply integrated skills for management of these diseases. And that is my last and final commitment. I want to once again thank you all for listening to me, and I wish you all fruitful deliberations at this meeting. We say, succeed, we must. Thank you very much.
Thank you so much, Prof. Let them give you another round of applause. Thank you, thank you so much. She has re-emphasized the issue of resilient health systems. She talked about road traffic injuries. I'm told in the breakaway sessions, I think one of the breakaway session will handle that. There is an aspect to deal with issues of trauma and injuries. Then commitment in terms of training, we appreciate. And we also appreciate your support that came through to support the event. At this point, ladies and gentlemen, let me invite the WR rep to come and make his presentation, or her presentation. Apologies.
Thank you very much, Masters of Ceremony. Honorable Minister of Health, the Permanent Secretary, Minister of Health, distinguished researchers, academic leaders, distinguished health development partners, heads of ministries, departments and agencies, civil society organizations, communities, the media, ladies and gentlemen, good afternoon. It is a pleasure to be with you here today at this pivotal National Annual Communicable and Non-Communicable Diseases Prevention and Control Conference. The conference theme, Unified Against Communicable and Non-Communicable Diseases, is both timely and transformative. Bringing together discussions on communicable and non-communicable diseases under one roof marks a decisive step towards building a resilient, integrated health system. This approach aligns very well with the World Health Organization Regional Director for Africa's manifesto, Building a Healthier Africa Together, which champions healthcare as a right, not a privilege, and calls for bottom-up primary healthcare-driven universal health coverage. Historically, vertical programs have delivered targeted results, but led to fragmentation of services and poor continuity of care. As risk profiles increasingly overlap, such as HIV and diabetes, HIV and hypertension, HIV and cervical cancer, this fragmentation is unsustainable. At this point, let me congratulate the ministry leadership for the integration agenda, that they are doing so well. And I think most of you saw the publication from WHO from 2 days ago, where it was giving guidance on how countries should deal with this issue of reduced financial support that we are experiencing. And Uganda is mentioned as an example that is doing very well in terms of integration, so congratulations to the ministry. So integration is our bridge to efficiency, equity, and sustainability. As you are aware, WHO defines integration as more than co-delivery. It's about coordinating the entire health ecosystem, training, supervision, supply chains, and legal frameworks, all delivered by multidisciplinary teams. Importantly, integration aligns with value for money principles, especially as global financial resources from donors continue to dwindle. We must do more with less and do it better. To realize people-centered integrated services, we must focus on 4 enablers. They've been mentioned before by my colleague, but I will reiterate them. The first one is breaking silos. We must dismantle operational barriers between communicable and non-communicable diseases. And I like Professor Roda's comment that we must do research that is targeted for the benefit of the poor that we serve. Let's not just make it an academic exercise, but it should benefit other people in the process. And we should be able to then come up with locally tailored solutions to address the chronic public health challenges and guide scalable models for integrated care. Secondly, we must harmonize our systems. Thirdly, we must prioritize prevention, and we must make a shift in terms of public awareness strategies, emphasizing early prevention alongside curative care for both communicable and non-communicable diseases. Lastly, we must invest in primary health care, embedding services for HIV, TB, malaria, and comorbidities into primary health care and community-based services, and this is essential for sustainable integration. Your expertise is not just valuable, it is transformative in shaping policy and driving innovation. The conference goal to explore communicable and non-communicable diseases linkage and develop actionable recommendations is a crucial step towards eliminating priority diseases and achieving health equity, aligning with WHO's Afro vision of ending diseases in Africa. Ladies and gentlemen, Uganda's commitment to integrated people-centered service delivery is a beacon of leadership in the region. By aligning our national strategies with the broader regional vision, we can confront complex health challenges with unity and purpose. United, let us build a healthier, more resilient, and prosperous Africa where no one is left behind. I thank you.
Thank you so much, WR Rep, for your remarks. A few highlights: healthcare is a right and not a privilege. Let's take note. We need also, she has emphasized the integration, breaking silos, do more with less, issues of efficiency and value for money, investment in PHC, and ensuring that there is health equity. Thank you so much. We appreciate these remarks. So like I had indicated earlier, this rare opportunity, I should not have it alone. I want to invite the Director of Public Health, who oversees both diseases, NCDs and communicable diseases, to come and take over at this point and be the one to invite the PS and the Honorable Minister to deliver their remarks. Thank you.
I want to thank the outgoing MC, the Undersecretary, Mr. Kenneth Akili, for learning all the science in just one lesson. Let's clap for him. Well done. We have very limited time, and it's my pleasure to bring you greetings from Dr. Charles Olaro, the Director General, who is not being able to be here, but has asked me to invite the Permanent Secretary to come and speak to us. Dr. Diana Twini, please come and speak to us. If you go away, then we will call you back for a group photo, but you can leave space. Okay.
Our Honorable Minister of Health, Honorable Jane Ruth Acheng Ochero, the Acting Director General, the Vice Chancellors of the respective universities, our senior officials from the Ministry of Health, our partners represented, academia, community, our civil society friends, ladies and gentlemen, allow me first of all to welcome you again to this very, very important conference. You have been invited specifically because of the role you play in the space of teaching, practice, both non-communicable and communicable diseases. So I really want to take this opportunity to congratulate you and congratulate the department of communicable diseases, although they've been working with non-communicable diseases, and allowing us to have this joint meeting. And I think we are walking the talk. I want to thank you very, very much for accepting. At first, we were scared that academia was not going to accept this, but we thank you very much for your flexibility to come together. I think we are beginning now to speak the language of unification. Today, the theme is so right at this time, at this season. Unified action against communicable and non-communicable diseases. And today I'm not going to talk about communicable disease because there are so many presentations, the statistics, the papers that are going to be presented. Today allow me to just focus on that word of unification, unified front. And I think that's what has been lacking. The knowledge of non-communicable diseases and communicable diseases is well known by all of us in this room. The science is well known. The practice is very clear. Where are the missing gaps? And I think today, in the next 3 days, if we focus on this unified front, I do believe that we'll get milestone out of this, and we'll be able to see us make great milestone, get to the level that we want to get, even with minimal resources. What has been missing is the unified front. And we are so glad that we've started this journey, and we hope that this journey, as we have started, will continue until we get to our target. And we must be very clear together as we discuss, as we present data. We request that we come very clear. We get very clear on issues. We get clear on the recommendations. We get clear on actions. We get clear on responsible people that are going to drive this agenda. Once those four are very clear out of this room, we'll be able to see us make great strides. On the side of Ministry of Health, we have made great strides. A lot of investments have been made in infrastructure development. That one, everybody can testify that we have done a lot. And we want to thank the government for making this happen, because right now, about 90% of our population can reach our facilities within 5 kilometers. So the access has been largely been achieved. But that's not enough. As we increase to roll out and upgrade more facilities in the sub-counties and in counties to make sure that the services are nearer to the people, as we continue to bring blood access to the people by expanding the blood banks in the regions, as we install and get access to diagnostic capacities in our regional referral hospitals and general hospitals and health centers, and strengthening the hubs in the country to ensure that the samples can be collected and tested by the skilled personnel to give the standard results that the clinicians can rely on. As we improve on the outreaches by scaling up the mobile X-rays to diagnose, as we scale up the outreaches in vaccines and by deploying vaccine vans to make sure that we get the people in the communities. It cannot be sufficient if we are not unified, because all of you in this room, you play a very critical role. The academia, we rely on you for research. And I'm so glad when Chirenga was standing here talking, and we see Pauline Biachika standing here, and we are seeing the Dean of School of Public Health taking the lead in this, we are very excited because I think this is what we want. We cannot talk about infrastructure and policies without talking about the service provider. It is a web. When we talk about service delivery, we are going to talk to deal with these monsters in the room, that both non-communicable and communicable diseases. We must focus on the service provider, the quality of the service provider. This morning before I came, I looked at the data of patient safety, the reports on patient safety. And we are seeing a lot of iatrogenicity on the rise. So we must talk about the quality of the service provider. We must talk about the caliber of the service provider. We must talk about the quantities, because right now we are grappling with understaffing, but also accentuated by pseudo-presentism. So we must, as we are talking about the monster of non-communicable diseases and communicable diseases, ladies and gentlemen, we must get back now to us. On the prevention, disease prevention, we are now rolling out community health extension workers in the country. We are supporting the VHTs to continue working and bridge the gap between the communities and the facilities and where we have community extension workers. But we must re-engineer the way we communicate to the community so that they embrace the message. Why are we still seeing many people going to Bone Center? On Saturday, I was closing the meeting of orthopedic surgeon. And one of the things that came out that we are getting so many complications of our people who get road traffic accident and they end up going to bone setters instead of coming to our facilities for care. Why? What is the missing link in our communication? We are still seeing quite a number of our mothers dying at the hands of traditional birth attendants. What is the missing in our communication? Academia, what can you do? How can we do social, those community studies? What are they called? I'm a scientist. I don't know the other things of social behavior. Okay, that one. What can we do to get the answers? Why are we not getting to the community so that we start changing that mindset? How can we get to elite? Even the elite, you find someone is 60 years, has never gone for medical checkup. They don't even know they are prostate, and especially men. Yes, it is true. It is very true. So as we come together, and I really want to conclude my remarks. Let it be not where networking and exchanging cards and presenting and showing how sophisticated we have been able to collect data and very, very, how impressive professors and all these, the clinicians, and let us go beyond that and interrogate those gaps and come out with tangible, practical solutions that can really help us. Why are we up to now still seeing a big burden of malaria? And we know we keep on talking about, we keep on having meetings. Professor Chirenga, he elaborated the function of conferences the usefulness of conferences, how we come together and network and exchange science, and after that, then what? Other countries have defeated some of these diseases, especially communicable diseases. What is the missing link? How can we do it better? Today we are going to make history in Uganda, that this conference will be the first. It will be a cornerstone for us to deal with our problems in the country. It is going to be our cornerstone to deal with problems that we are not going to use other people's data. We are not going to use other people's experience. We are going to use our innovation in the country. We are going to use our statistics. And I thank Rhoda because she touched on it, and it's like she had my mind. Data, evidence-based. As we challenge each other here, as we present all this information here, we must interrogate that data and say, what can we, now we have evidence, how can we use this evidence now to come up with strategies? So as I conclude, I wanted just to emphasize a number of things. There has been a talk, there is this word multi-sectoral approach. Yeah? Haven't you been hearing it in every conference? Multi-sectoral collaboration. It is a very ancient word. We must refocus on this multi-sectoral collaboration. And let us walk the talk like how we have started today. We have a number of things, and I think Dr. Dube talked about this. There are so many other factors that are interconnected. Let me give an example, nutrition. Do we have agriculture in this room? If we are going to talk about factors that are affecting our mothers and children, and we are talking about nutrition as one of even TB is related to malnutrition. Do we have agriculture? Are they in the room? Because we must work with them. Do we have gender? Do we have education in the room? If we talk about road traffic accident, that is increasing our expenditures. If Mulago told you the budget they are spending on road traffic accident, if you visit their neuro ward, and how long the patient taking that on those wards, and the money we are spending. I think I've seen Karyesubula here. He will share, hopefully, the money we are spending in kidney disease, even dialysis. Yet we can prevent, but we can't do this alone because there are so many other factors. The Ministry of Environment has a big role to play on how we manage environment so that we reduce on carcinogenic exposures. So we must have a matrix so that when we start this journey, we bring everybody on board and we ask this hard question to each other so that we commit because we are one society. We should not leave this room without talking about alternative health financing. Because as we are talking about disease burden, it goes along with resources. With minimal resources, with a large, big burden of disease. What alternatives? What high impact interventions that can we embrace and we bring down the cost, we bring down the disease burden. So health financing, although this now we are focusing on the diseases, But there is a very strong interlinkage on on how we are going to manage our health sector, how to manage this disease burden, and strategic investment to deal with these diseases. We must not forget about quality of care. Disease burden. I have a patient who came to the hospital, and just because someone had high lymphocytosis in one of the private hospital, just he had high lymphocytosis with marginal neutrophilia, with no any other symptoms. Someone was prescribed meropenem, 7 doses. Oh yeah, I am giving you the story. So if we are really going to talk about care, prevention, care, and even aftercare, we must focus on quality of care. Because we will not have enough resources, but we must optimize resources. Now someone is giving meropenem because someone has just marginal lymphocytosis and neutrophilia, sorry. Academia, we depend on you for innovative ways. Innovative ways. We are going to keep on coming back to you. The research that we are doing in the country must not be based on who has brought money from outside. Must be able to answer our questions, inherent questions that will help us to answer our questions. Allow me to conclude by thanking all the partners that supported us. Without you, we will not be here. Thank you for organizing committee for this innovative approach. Thank you for all participants that coming. I like talking. Let me conclude by inviting my boss, Honorable Ruth Jenna Cheng Ochero is in our midst. She's one of the most hardworking ministers I know in this country. She's one of those most patriotic Ugandans I have known. And she's actually now standing to lead the people of Lira City. But as she stands, I want all of you just to stretch your hands to her. And just before she comes, we bless you, we pray for the success, that all the barriers are removed for you, that you come back. Please, can you come and address us?
Madam PS, thank you very much for the prayer. The PS Ministry of Health and the entire technical team of directors and commissioners, the World Health Organization representative and all our development partners, the Vice Chancellor, Mbarara University, Deputy Vice Chancellor, Makerere University, all representatives from academia, the Principal, Makerere University, the Dean School of Public Health, civil society organizations, private sector, the media, ladies and gentlemen. It is indeed a great honor and privilege to welcome you to the inaugural National Annual Communicable and Non-Communicable Diseases Conference, held jointly with the 19th Joint Annual Scientific Health Conference 2025. This collaboration between the Ministry of Health and Makerere University School of Public Health demonstrates our shared commitment to advancing health, research, policy, and practice. And allow me also to add my voice to deeply appreciate Makerere University and of course all the other universities present for this collaboration. And also in a special way to thank the Department of Communicable and Non-Communicable Diseases for organizing this conference. And furthermore, to appreciate the keynote speaker who really took us through the issues very well, Dr. Queen Dube, thank you very much. We have made progress as a country, commendable progress in the last several years. And as Professor Bruce clearly put it, we are here to protect the gains. And integration is one of the best ways to protect these gains. So if you find yourself here and you're not willing to protect the gains, then you are misplaced. We don't want people who are learning to come and start learning on us. We are already moving. The Minister of Finance said we are moving. So we should continue moving. Let me just go through a few of the gains, and I will start from the one I love most, that is childhood vaccination coverage. That has risen from 37% in the year 2000 to 68% in 2022, supported by an expanded vaccine portfolio of 14 antigens, including the new malaria vaccine and hepatitis B birth dose. This is good progress. Among the African countries, I think Uganda has the highest number of antigens, and we must appreciate the technical teams that are doing this together with the pediatricians. It's one of the reasons why our life expectancy has increased, because we are using the resources for other things. Childhood stunting has also reduced from 45% to 26%. Although I see many people don't grow very tall these days, I think I need to ask the academicians to tell us why. I'm one of them. But I'm not from these days, I'm from those days. Our life expectancy as a country has increased from 45 years in 1986 to 68 years in 2022. Although from Queen's presentation, I saw that we were still low, but we are better than many. That is something to appreciate. HIV control remains strong. 94% of people living with HIV know their status. 90% are on ART, and 97% are virally suppressed. So the question that I will throw to you is whether by 2030 we shall end AIDS. That is for all of you here in the room. I'm sure at the end of the conference, you will be able to give us the answers. Malaria incidence has dropped from 308 to 274 per 1,000 since 2019, although I'm told the prevalence has started rising back. And again, I know there are experts in this room to tell us what has gone wrong and what we need to do to get back on track. TB treatment success has improved from below 50% in 2015 to over 90% today. And we want to thank the TB program. I think it happened during Stavia's time. Thank you very much. For NCDs, screening and care for hypertension, diabetes, and cervical cancer have been decentralized to all health center 3s and 4s. By the way, screening for hypertension has been decentralized down to the communities. The community health workers have been empowered with blood pressure machines, and they are doing this. So this is progress as well. Screening for cervical cancer rose from 10% to 23% in 2023. And again, although we blame the men for not checking their prostates, I wonder if I asked how many ladies have screened for cervical cancer in this room, how many would put up their hands? So the men don't feel depressed. That cuts across, especially among the elite. Our annual National Day of Physical Activity continues to promote healthy lifestyles and prevention of non-communicable diseases. And I want to implore all of you here in the room, to become active and take exercising as something that is very serious. It should be part of your menu every day, part of your menu. If you are not doing it, do it. If you're already doing it, uphold what you are doing. It saves lives. These gains reflect strong and long-term collaboration between government, partners, academia, and the communities. And we are grateful. And of course, when I mention partners, I'm including civil society, development, private sector, and all that, because we can't do it alone. And that is why we are all here together, again, to reflect on our actions. While progress has been made, challenges still remain. There are deep geographic disparities in access to quality health services, with rural areas facing significant challenges. And again, while government has made progress in infrastructure, the majority of our infrastructure is for primary health care. Access to specialized treatment remains a nightmare for many. Remains a nightmare for many. And we need to work on this, because many of you here in this room do not require primary health care services. You require tertiary. Currently, 29.1% of Ugandans are either overweight or obese, which is a bad indicator in view of a potential chance of developing non-communicable diseases, especially hypertension and diabetes. And we already know our statistics. I'm sure you were told. I'm not going to repeat, but you can be counting amongst yourselves how many are hypertensive. Levels of obesity, especially among women, most especially those that are elite, and the men living in urban areas, is very worrying. We also want to take note that reducing the burden of genetic diseases like sickle cell disease through premarital counseling and improving the quality of care should seriously be undertaken, plus having a statutory instrument, just like we did for HIV, if we are to make progress. The uptake of new antigens is also still suboptimal, fueled by misinformation, myths, and rumors. There is need to focus on timely vaccination and completion of the recommended doses. I am convinced that all of us here in this room can undertake to demystify what is currently going on and improve our vaccination uptake. So to address these challenges, let's work together to strengthen our health systems even further, ensuring that services are accessible, equitable, and of high quality for both primary health care and specialized services. We need to enhance our community engagement and empowerment, enabling individuals to make informed health decisions, providing information to all who need the information, and especially people who are here. And I want to thank again the emphasis on bringing all of us closer to share the science from the research. We need to foster partnerships across sectors and actors to create a supportive environment for elimination of communicable and non-communicable diseases. It is always unfortunate that in international conferences, it is always Africa that is being referred to as left behind, never finished the Millennium Development Goals. Now soon we shall be arriving to 2030. Again, it will be Africa that has not met the SDGs. But can't we set our own? Why should we always have to depend on theirs? Can't we set our own targets as Africa and achieve them? Because those targets are set by people who have already moved closer to the targets. And they want us to run a very long race, and in the middle of the race, they withdraw the resources so that you fall back and you never get there. And yet, we provide the market. We provide the market. Anyway, let me join Professor Bruce to invite you also for the Africa Health Summit. It is important that you come, but you forgot to tell us whether we are all invited. You know, sometimes we issue invitations and then you say come with a card. So if we are all invited, all these people will report to Kololo. On the, are you ready to take care of us? Very good. So all of you come. If it doesn't allow you in, you alert me. Let me also give my call to action. And it will be based on the theme, which is unified action against communicable and non-communicable diseases. This calls for integrated, people-centered approaches to prevention and care. Disease control is not the responsibility of the health sector alone. It requires collaboration with many other sectors, many others, as we have been mentioning: education, local government, water, sanitation, transport, and so on and so forth. And therefore, it is important that they all come on board so that we can advance our agenda of disease prevention and a healthier and productive population. I wish to extend sincere appreciation to all partners supporting disease prevention and control of both communicable and non-communicable diseases, and many others whose contributions have driven us towards this success. Allow me to mention a few: WHO, UNICEF, CHAI, IDI, JAPIGO, PSI, Gavi, Global Fund, the academia, private sector, civil society. If I have not mentioned, you don't get annoyed, and all of you. As I open this conference, I appeal to all of us to renew our commitment to prevention, innovation, and partnership. Every policy, every intervention, and every community effort matters. Unified action is urgent if we are to end preventable, communicable, and non-communicable diseases by 2030. It is now my honor and pleasure to declare this conference officially opened for God and my country.
Please, I invite you to stand and we sing the national anthem. Thank you very much. We are going to have some photographs taken here at the podium. I'm going to invite the people to stand here and somebody to arrange us. The rest you can sit, but in the meanwhile, Honorable Minister, there are people who you wanted to know whether they are here. As they come for the photo, so the photo, somebody's coming to arrange and help us take the photo from the front here. So the people who are here, plus those who spoke. Kenneth, please come. Just move to the front. Can somebody help me organize the picture? Whoever is taking it, please. Dr. Stavia, come.
For this one,
Yes. We can stand for now. You'll wait until I join.
I didn't speak. Hey, Professor needs space somewhere.
Sorry, we have more people coming. You know, in this meeting, we had the Minister, PS, Kenneth Akili. We have the Acting Director General. We have Dr. Pauline Biachika, Vice Chancellor, Mbarara University. Emmanuel Tuganero, representing Chancellor Equity University. Where are you? Please join the picture. They are all here. I'm adding to the list. I'm not missing. I already joined. Dr. Andrew Kambogo, representing IDI, Executive Director, IDI. Dr. Professor Chirenga, Principal, College of Health Sciences. Dr. Michael Equate, Executive Director, TASO. We are still organizing more pictures. We are going to call more people. Dr. Mr. Mulumba Matthias, representing civil society. Dr. Noah Anthony, representing Malaria Consortium. Professor Moses Kamia, Executive Director, IDRC. Dr. Fred Magala, represent ED, AF. Dr. David Musoke, Associate Professor, Makerere University School of Public. Professor Richard Idro. Professor Robert Wamala, representing Vice Chancellor, Makerere University. Commissioners, Ministries of Health. Dr. Alan Murutayu here, Dr. Charles Oyo, Dr. Opentho, Dr. Navasa, Dr. Susan Nabada, and all the assistant commissioners in the room. Partners, I hope these are all growing pictures. So, assistant commissioners in the room, Dr. Nansing. We have, the photo is full. It's a growing picture as more are added. Representatives from partners, DELF, MRC, Unitaid, CHAI, PSI, CREM, Queer IAI, JSHC, UNACO, UNSCOH, UNEP, UNIPH, JAPIGO, UVRI. How many are those? Many more pictures. So the next growing level, officials from Ministry of Health and all the organizing committee. Sorry. The picture is growing. DHOs. Is it growing? DHOs. Now the next one is going to make the stage collapse. But listen. Local government leaders and researchers. So the last one is going to make the stage collapse. So that's why I had to wait. Because everybody is a researcher. And all the presenters, Professor Goa today, should not stay in his chair. So some can start leaving so that the researchers may have a chance. So we have CSOs. I will also read you. So at the end, we shall have organizing committee alone. So if you are organizing committee, you can still stand aside and we let all the researchers have a moment. Please don't break the stage. CSOs, we have HIPAC, CCM, TASO, PRA2, executive directors for the different diseases, HIV, malaria, TB, networks, executive directors of international CS. Now, faith-based organizations and cultural institutions. I don't see the researchers going away. I think I made a mistake of calling them. So now, local leaders, traditional leaders, faith-based organization leaders. CSOs, you can stand here. I know you. If you miss a picture, I mean miss my lunch. So I'll call Michael to come here and direct us on how we're going to do the afternoon session. Michael MC. Okay, now can we have the organizing committee alone? If you are not part of the organizing committee, thank you for standing here, but give them space. Only organizing committee. CSOs, I know. Can we have the friends who are organizing committee alone? It's impossible to have the CSOs move away, but I insist. Your picture we have We have your picture. So can we have the organizing committee? I'm waiting for you, Dr. Maureen. This picture won't be started until you arrive. Now, if you are not organizing committee and they see you in the